lot of you just kind of stands up and says, yay, we could win this year, or, you know, for 2008.
We have no bad candidates. They would all be credible, honorable, great. So
what got you really excited?
Hillary. Yay.
Why?
Well, she was so good, and, you know, she has the experience. She talked about the health issues. You know, who better to do that? And, you know,
she had a great health care plan. How many years? 12 years ago. She had a great health care plan.
she has experience in the White House.
And the next candidate, Senator Hillary Clinton. But let's begin with Iraq. It is the #1 issue in this campaign. You heard Senator Dodd explain why he thought his vote was a mistake. Why wasn't your vote a mistake? And why are you against the proposals, particularly of Governor Vilsack, who says we have to bring the U.S. troops home right now by cutting off funding and only fund a small strategic force in northern Iraq?
You know, George, my vote was a sincere vote based on the facts and assurances that I had at the time. I have introduced legislation to stop the escalation, to protect our troops, because it is a disgrace that the President is sending into harm's way young men and women who do not have all of the equipment, the body armor, and other equipment and training that they need. My legislation would also say to the Iraqis, enough. We are not going to fight your battles. We are not sending our young men and women in. You have to be on the front lines of your own defense. And as far as I'm concerned, people ask me, well, why don't you want to cut money for American troops? I want to cut money for Iraqi troops. I want to cut the money that they get because they're not standing up and fighting the way that they have said they would.
Health care. Many experts projected it would cost between $90 and $120 billion to actually achieve universal health care for everyone in America. With the nation's deficit and the price tag of the Iraq War straining our budget, is comprehensive health care reform achievable in the near future? And if comprehensive reform is not possible, would you pursue incremental steps toward that goal, or do you view that approach as Band-Aid therapy for a hemorrhaging wound?
It's a great question, and you know, I have a little bit of experience in trying to reform health care, and I still have the scars to show for it. I needed some health care after that was over. But I believe the question is really an important one. We already spend more money than anybody else in the world, by about $800 billion, and we don't even insure everybody. We have 47 million uninsured, and then we have millions of the rest of us who, in effect, are underinsured because when our doctor says we need a certain treatment, the insurance company says no, and you've got to argue to get what your doctor has said you need. The President's budget wants to cut the Children's Health Insurance Program, and I worked on that during the Clinton administration. I think we should be insuring more children, not cutting the children of hardworking families off of the Children's Health Insurance Program. And I am absolutely convinced this time we're going to do it, because the people that come to talk to me now, they're CEOs of companies. They're doctors and nurses and hospital administrators. They know that if we don't change the system we have, it's going to continue to hemorrhage money. We're going to have more uninsured people. We're going to have the fastest growing problem of people who are not going to get what they thought they paid for. And we're going to continue to lose jobs. They're going to be sent to other countries because we're not being able to provide health care at a decent cost. So I'm very excited about what I'm going to do. You know, President Kennedy said in his inauguration that he wanted to have a man on the moon by the end of the decade. Well, I want to have universal health care coverage by the end of my second term. And with everybody working on that, I think we can do it. And you know, I believe Bill Clinton was a good president, and I'm very proud of the record of his 2 terms.
Thank you for your help today. Thank you. Nice to see you. Thank you very much.
Bye-bye.
Bye-bye.